I would like to ask Gina to unmute and provide us with your public comments.
Sure. Thank you for delaying your break for me. And it's very brief comments, of course. I'm Gina Solomon. I'm a clinical professor in the Department of Medicine and Division of Occupational Environmental Medicine at UCSF, and a principal investigator at the Public Health Institute in Oakland, where I do my research. And so I have some experience both in the clinical world and also in the research world with PFAS. I'm doing a study right now in California on drinking water, in which we're partnering with USGS to do the targeted testing for their ever-expanding array of PFAS chemicals in water. And EPA ORD is doing the non-targeted testing on our samples. And we're finding that people can handle some of the ambiguity of the results return that is inherent in the biomonitoring and water testing work. I initially was a little concerned, would people be able to, how would people deal with all of the uncertainty in this area of science, and the fact that we sometimes can't give precise information about what level is of concern and what is not, and so forth, the changing sets of PFAS chemicals. And so I just wanted to say that based on our experience, people can handle a lot of this kind of nuanced information, but it does, clinicians will need a lot of support to help with how to communicate these findings. My other point is something that several of the other speakers mentioned. I've been sort of in and out listening today. A lot of fantastic and important comments. And that the point here is that, if we don't know what's in products, what's in the water, what is in the chemicals that people are handling in the workplace, and in many cases, the safety data sheets don't actually name specific chemicals, then it becomes very hard to know what to test for. And so there is a threshold problem there. It's in a way, sort of, you could argue, oh, well, is that outside the charge for this committee? But on the other hand, it really is important to comment on, because if your charge is to comment on what should be tested for, it's important to know what's out there and to address some of those big gaps in terms of what's in products, what's in chemicals that workers are handling. We certainly heard a great example with the turnout gear, and so those are my two main comments. The threshold issue of clinicians needing to know what people are exposed to in order to know what test to order, and then the fact that people can handle nuanced and difficult results of biomonitoring. Biomonitoring California has also shown that that's absolutely feasible to do. So thank you very much. Good luck with this very interesting assignment that you have, and I look forward to reading your report.
Thank you so much, and thank you for taking time today and joining us as well.